And joining us now, as promised, here on the This Is the Day set, the Catholic TV living room, is Teresa Larkin. She is the executive director of Your Options and also the vice chairman of the Pregnancy Care Alliance of Massachusetts, otherwise known as
PCAL.
PCAL. Thank you. I want to say it correctly. Welcome, Teresa. It's great to have you in the living room.
Thank you for having me.
It's great to be with you. And let's start with the PCAL, Pregnancy Care Alliance. Tell us how the alliance began and why it was so needed and still is.
Well, shortly after the Dobbs decision was released, pregnancy centers throughout the country, especially in Massachusetts, were beginning to be attacked and being vandalized, and all kinds of negative press we were receiving, which frankly shocked us. None of us were prepared for that. We didn't expect any of that. We had been operating many centers for over 30 years, sort of in the shadows, doing what we do without any real public attention on us. And so we decided that it was really important that all of the centers got together to support each other and to see what was happening and how we could sort of unite to give a positive message to all these attacks that were happening.
Makes sense. Thank you.
And there was a consumer advisory report.
Correct.
Yeah. Can you tell me a little more about that?
Yes. So the Attorney General, who's now the governor, issued a consumer advisory warning against centers like ours, accusing us of deceiving women and not being medical and false advertising. So there was a lot of very, frankly, disturbing claims that were false, that were being levied against us. So that was our first attempt, was how do we push back? How do we correct all of these allegations?
So does this vandalization, is it ongoing, or do you feel that because of the alliance you've made some real progress?
Well, initially the vandalism was pretty bad. Our center in Revere was actually tagged with the Jane's Revenge slogan, "If abortions aren't safe, neither are you." We recently had our very first open house, PCAL sponsored Saturday. We had open houses throughout the state at several of the centers. Our intent was to invite people in who didn't know who we were. All the legislators were invited, as well as local supporters, to just come learn a little bit more. At several of the centers, there were protesters. They were peaceful, which was wonderful. And in many cases, we were able to begin a dialogue with some of the people. So that was very, very encouraging.
And then someone comes to one of these open houses, they find out about what services that you provide. What are those services?
Yes. Well, many of the centers offer different types of services. Our center is medically licensed. So the services that we provide are free pregnancy testing, ultrasound exams, an opportunity for someone to meet with an advocate to go over what some of the challenges and struggles they are, to maybe be thinking of why they're thinking of abortion. So most of the women that we see at these centers are either thinking, planning, considering abortion. And our aim and goal is to help them see that they don't have to make that choice. There's alternatives. Hence, there's other options available to them.
You do such great work. If someone was watching this program right now and was pregnant and experiencing some sort of crisis, what would you say to them?
The most important thing, I think, is for people to slow down and get real information and think about it. When you're in a crisis, how many of us know if we make a rash decision and we do something without thinking it through, those are the decisions we often tend to regret in life, right? And that's what we try to get women, is you're not going to have this baby tomorrow. You have time to think things through, get things lined up. There's plenty of time, and that's, I think, what's the driving factor is if we can just get women to slow down, process the reality that I'm pregnant and what am I going to do, and to hear that there's help, there's support, there's a lot of resources that can help them, and not to panic, because they all think worst case scenario. My mother's going to throw me out. So-and-so's never going to talk to me again. I'm never going to be able to finish school. And the reality is most of those things don't happen.
Okay.
And you can finish school and you can work. So we try to take a very positive, pro-women, yes, you can. Yes, you can do this.
There are options.
You can do this.
Yeah.
So we hear all of this, and obviously we're naturally inclined to support you, but it seems so obvious. Like, who wouldn't like this idea? But there are a lot of misinformation and misconceptions out there. What are those misconceptions, you think?
One of the misperceptions that we actually learned from on Saturday, speaking with the protesters, was a forced birth. That, you know, you're forcing women to have these babies and subjecting them to like a lifestyle of economic hardship and burdens, and, you know, and not everyone wants children, and you're kind of forcing, and it's kind of interesting to hear that perspective. The others, they always think too that we don't help women, that we just about saving the baby and we don't care about the mom. But that again is absolutely not true. You know, we're in there for both. Both of them are important, because we know, right? Only the mother can save her baby. So if we ignore the mother, then that just is not going to go anywhere. Yeah, so that we do help, we do support after birth. You know, it's not just save this baby and hey, you're on your own. It's no, we're here to help and support the mother, the family, for as long as we can.
We're almost out of time, but just quickly, what is it like for you to provide these options to women, to ask them to slow down, to support them in a moment of crisis? What's it like for you personally?
It's pretty amazing. You know, you really learn to understand and really to be empathetic, to understand that people are hurting and they're struggling. And then yet you see so much courage, you know, women who then say, no, I am going to have this baby. It's an incredible experience to see someone change their mind, or to see someone at that ultrasound, that moment, and say, that's my baby. And that switch from, oh, this is something unwanted, to that's my baby. So it's just an incredible blessing.
And how can people find out more information about the work you do?
To find out about Pregnancy Care Alliance, we have Pregnancy Care Alliance, PCAL, I'm losing it, .com. I had it, pregnancycarealliance.com.
Okay.
And then youroptionsma.org is our patient-facing website. So if someone needs our services, partnersofyom.org is for if you're interested in volunteering or learning more about the organization.
Youroptionsma.com.
.org.
.org. Got to remember that. It says .com here, so I'm going to correct that. Your Options MA, which means Massachusetts, stands for Massachusetts. .com. Teresa, thank you so much for being with us.
You're very welcome.
Sharing the very important work you're doing for women and their babies. So, and I like the fact that you're having that dialogue with people. It's very much in the spirit of the Synod and what Pope Francis wants us to do.
Right.
You know, even if we disagree.
Right. To be Christ-like. To be Christ-like.
Exactly.
Right.
Yeah. Wonderful. Thank you for letting us know, and we hope that if someone's listening and they need a little help, that they'll look for you at youroptionsma.org. I got it right that time.